Hi, everyone. Thank you so much for joining us today in our webinar. I'm so glad y'all can make it here today. I'm very excited to be a part of this really informative and educational session here, all about managing pain with non-opioids. So today we have a very special guest who will be doing our presentation, and I will introduce her to you guys here shortly, but I just also wanted to make sure you know that how this whole thing is going to work. So this presentation will be recorded, and we will cover the educational topics here, and you'll see everything using the slides that's going to show up on your screen. And after the presentation, we will have a time for some questions. You can submit your questions throughout the event using the control panel. So let us know if you have questions that you want us to ask the presenter here today. And as long as we have the time for it, we'll go ahead and ask those questions live. And once we're done, the recording will be posted on our website, and you'll have access to it as well. So thank you again for being here, and let me introduce to you the speaker for today. Her name is Dr. Dweck, Alyssa Dweck. Dr. Dweck is a practicing gynecologist in Westchester County, New York, and she is also an assistant clinical professor in the Department of Obstetrics, Gynecology, and Reproductive Science at the Mount Sinai School of Medicine, and a consultant at Massachusetts General Hospital, Vincent Memorial OBGYN Service. She's also the author of 3 books focused on women's health and sexuality. She's also on the Health Advisory Board of Family Circle and contributes regularly to women's health. He has been featured in Cosmopolitan, Shape, Health, 17, BuzzFeed, and a guest on the Today Show and Good Day LA. And she's also a mom of 2 boys and a bulldog. So we're very happy to have her here. Welcome, Dr. Dweck, and please take it away from here.
Great. Thank you so much for having me. I'm really excited to speak about this topic, which is near and dear to me since I live and breathe surgery and deliveries day to day in my gynecologic practice. So we can move on to the next slide. So I've been practicing for more than 20 years. I've also written a couple of books on gynecology and all things about feminine health. And so I really feel so passionate about this subject matter. And I feel that I bring a personal experience to the subject matter because I did go through childbirth myself. I will say that made me a way better doctor and much more empathetic and understanding. So with that, I'm going to move on and speak to you today. So I think it's really important to realize that women really are the gateway and entryway to the medical system for their families. In fact, they almost work as a chief medical officer of their homes and their families. So as a working mom, I am all too familiar with the multitasking and the challenges that women face, and I know that it really is a big balancing act. We not only take care of ourselves, but we are responsible for handling medical care and prescriptions and medications for our children, our spouses, and even our aging parents. In fact, nearly 60% of women make the healthcare decisions for others, but the scary thing is that 58% of these women do not necessarily have confidence in their own decisions. So, for this reason, I feel it's so important that we empower women with knowledge, particularly when it comes to pain control related to childbirth and gynecologic care, since that's going to be their personal experience. In light of today's opioid epidemic, which we're all hearing so much about day to day, I am going to share insights into this problem that specifically are applicable to the surgical setting. It is definitely time to empower women to take an active role in the management and decision-making surrounding post-surgical pain. And this may have to do with childbearing or gynecologic surgery or surgeries that people in women's families are dealing with. So Pacira Pharmaceuticals, which is the sponsor of today's webinar, is also passionate about empowering patients, particularly when it comes to managing pain after surgery without narcotics or opioids. So a couple of years back, Pacira conducted an extensive research to shed light on patient and clinician perceptions and experience with opioids. And they found a couple of really key points. First, it seems that a vast majority of women, 9 in 10 patients, receive opioids to manage pain after surgery. And this came as a big surprise to me, but 1 in 10 patients admit that they have become addicted or dependent on opioids after being exposed to these meds following an operation. And this is an area where we can really try to intervene and help to prevent a dependency. 91% of surgeons indicated that they frequently felt pressure to prescribe more opioids than patients actually needed after a procedure. Despite alternatives being available, less than 25% of patients are actually talking to their doctors about non-opioid options. So this is something that we really can work on and we can use as an opportunity. These numbers do seem to align with what we're seeing in the news right now, that there is a vast impact that the opioid epidemic has had on the country, and we're hoping to really address that and try to change this, because what we've really realized is that surgery has become an inadvertent gateway to the opioid epidemic. And there is definitely a time and place for opioids, but the post-surgical space is one area where we have a huge opportunity to really decrease opioid use. So, given the clear need to cultivate better communication between patients and surgeons regarding all available post-surgical pain management options, Pacira Pharmaceuticals developed a campaign called Choices Matter. I'm so sorry, I think I got disconnected for a moment, but I'm back. Choices Matter is an initiative that aims to educate and empower patients and physicians about their options when it comes to post-surgical pain control. The goal is to promote proactive discussions before surgery about non-opioid alternatives. Patients and caregivers need to know that there are a range of non-opioid options available that can effectively manage pain after surgery while minimizing or even eliminating the need for opioids. So my patients, for example, when I operate doing a hysterectomy or even a C-section, receive a long-acting local anesthetic, which I inject into the incision site or other areas of tissue during surgery to numb the area for the first few days postoperatively, and this has proven to be incredibly effective and a great way to cut down on the amount of medication that's needed after surgery, including narcotic use. And keep in mind, opioids often have undesirable side effects. Lots of women will complain of constipation or grogginess or loopiness and inability to really get up and out of bed and get back to normal function. So, unfortunately, most patients and caregivers do not necessarily question the volume of opioids that they're prescribed, and they may even be unaware or that they have choices when it comes to post-surgical pain management. So it's a conversation that we certainly need to have. Nobody ever thinks that opioid addiction will happen to them or somebody that they love and know. But here is a really shocking truth. Addiction can happen to anyone, anywhere, at any time. In fact, research shows that women are even at higher risk of becoming addicted to an opioid than their male counterparts. According to the United States for non-dependence report, women are outpacing men in their use of opioids. In 2016, 30% more opioid prescriptions were written for women than for men. And this disparity may be present for various reasons, but I feel that some of the higher prevalence is because some women suffer from chronic diseases that involve chronic pain more commonly than men, and therefore are more commonly treated with opioids. This report noted on this slide reveals information that was conducted by the Quintiles IMS Institute. Also found that while men and women on average are prescribed similar amounts of opioids to treat post-surgical pain, more women than men become newly persistent users of these drugs. What is a newly persistent user? This means that women are more likely to continue to use opioids 3 to 6 months after surgery than men. And these folks have a higher risk for dependence and addiction in future. You know, I wonder why women become more opioid dependent than men, and I feel that it's likely due to differences in body fat, differences in metabolism, and differences in their hormonal makeup. So we really have to be on guard for this. While this analysis examined a variety of procedures from shoulder surgeries to hip replacements to hysterectomies, I'd like to turn our attention to the most common inpatient surgical procedure for women, which would be C-sections. So let's take a look at the information regarding C-sections specifically. As moms, you likely at least know somebody who's had a C-section, and you very well may have had one on your own. Based on recent survey information of moms and moms-to-be that was conducted by Moms Meet, more than 1 in 3 women had a C-section delivery, and 1 in 5 women had an unplanned C-section. Even though most moms might envision having a vaginal delivery, we all know that even the best laid plans don't always go as expected. So regardless if your C-section was an emergency, a planned delivery, new moms want to feel good after delivery. They want to take care of their newborns and be present. They want to be up, walking around as soon as possible. They want to bond with their babies and not feel loopy or groggy. They also want to breastfeed and care for their babies and themselves. Nobody wants to be laying in bed in pain, relying on others to help them do the basics. And bottom line, women want to get out of the hospital quickly so they can get back to their families and feel at home. So typical side effects of some of the pain medication that has been given in past with narcotics can cause terrible gas pain after C-section, constipation, nausea, mental fogginess, and this is what I'm seeing in terms of narcotic side effects. So we're really trying to move towards using alternatives, which include this long-acting locally injected medication and other medicines that are non-narcotic in nature. Although opioids are being prescribed to the majority of new moms, the survey found that nearly 9 in 10 women admit they were concerned about taking opioids during and after childbirth. The figure that you see on this slide reveals that the top concern for most women, up to 53%, was that taking opioids during or after childbirth could affect their ability to breastfeed or have a negative impact on their babies. Another interesting stat shown here on this figure reveals that nearly a quarter of women were concerned about the risk of addiction or dependence after taking opioids or during childbirth in general. So I think this concern has really come about as more common because there is such a focus and awareness in the country about the opioid addiction problem. But what I see in my own practice is that women are much more concerned about the care of their newborns than they are of their own personal exposure. And this is really crucial. Regardless of route of delivery, whether it's vaginal delivery or C-section, there are a few consistent attitudes and beliefs towards using opioids when it came to managing pain of childbirth. So for example, 19% of women were okay with opioids being used for other surgical procedures, but not childbirth. Again, this points towards women being much more concerned about their babies and their newborn's health than their own. In addition, 25% of women believe that they were able to handle pain without opioids, and part of this is preparation and setting realistic expectations at the time of delivery. 21% of women have no issue taking medications, and a whopping 35% of women were willing to just let their doctor handle what's best when it came to postoperative pain control. This is a big deal, and I think it opens an opportunity for conversation between patients and their healthcare providers. It also allows physicians a unique opportunity to have a candid conversation with patients about what's safest and what's an alternative and very effective option instead of your typical opioid medications. Women are definitely interested in non-opioid options. Not only do these effective options exist, but 74% of women believe a non-opioid option is appealing to manage the pain of childbirth, but only 11% have actually discussed these options with their doctors. It's promising to see that there is interest from women all over the country about managing pain without opioids. When I started practice more than 20 years ago, it was almost autopilot to just prescribe typical narcotics after any delivery and prescribe them without limit and without hesitation and just kind of leave people to their own to decide when to stop. This has clearly shifted since I've been in practice, and over the last couple of years for sure, we're seeing less and less opioid prescribing regularly and more thought going into the non-opioid alternatives, including long-acting injectable anesthetics that are used during any procedures. I really encourage all patients to speak to their healthcare providers about options that are available. It can be overwhelming, but it's a conversation very worth having. What should you be asking your surgeon and when? Well, here are a couple of questions that would simplify and really make it easier to start this dialogue with your doctor. First of all, best to consider these questions before you go into labor or before a scheduled delivery. So I typically ask my patients to come up with a birth plan, and pain control should be included in that. This can be done as early as even 28 weeks of gestation so that you have plenty of time to think about it, especially since changes may occur with each of your visits. Typical questions to consider would be, how much discomfort is usually associated with this procedure? Post-op pain can be dependent on surgical site, whether a minimally invasive technique is used, one's own individual pain threshold, and your surgeon should be helpful in managing expectations of pain realistically. Another question, how can I minimize the need for opioids? What non-opioids options do I have at my disposal? Again, your surgeon will likely administer a variety of medications before, during, and after surgery to minimize or even eliminate the need for opioids, and it's important to ask what's available. What do you need to know about me to help me customize my pain management? Well, before surgery, your surgeon is going to elicit a fairly detailed medical history, including a list of medications and supplements that you might be taking, drug allergies or sensitivities, medical conditions including breathing, heart, or stomach issues, and they should elicit a history of substance misuse, narcotics, and smoking. All of these things might be crucial to consideration of medication post-operatively. A last question, what happens when medications from my surgery wear off, and how will my pain be managed at home? And you know, this is really important because most of us will give written instruction with pain medication suggestions that are typically even over-the-counter pain medications to manage post-op pain. This way, you can prepare and have things at home available to you, particularly if you're coming home with a brand new baby. These questions apply to any surgical procedure, whether it's gynecologic, C-section, or some of the other procedures that we've mentioned. Please also consider taking advantage of some online resources to peruse. There is information on planagainstpain.com, a wonderful website that goes through a question plan for you. So if you do have more information, please visit that website. Plan Against Pain is a robust website. It has a variety of resources to help you plan for surgery and afterwards. And it's always helpful to your healthcare provider to come prepared to your pre-op appointment so that your post-op time is easily managed. So with that, I'd like to end and open to questions. And thank you so much.
Yeah, thank you so much for that, all that information, Dr. Dweck. It was really good to get all of the data and the information from you. I'm seeing a lot of comments from our attendees saying that they've learned a lot. They're definitely going to be sharing the information to people they know as well. So thank you again. So we have some great questions here that we'd love to, to ask you, Dr. Dweck, and everyone continue to post your questions in the control panel, and we'll get to as many as we can. We do have a representative from PostOperative here as well. So if there's any questions specific to this item, this medication, then we can definitely try to address as much as we can here. One of the first questions, Dr. Dweck, that we want to cover is if you could briefly explain or describe how opioids are different than something like an Advil or a Tylenol.
Sure, great question. So opioids are a particular class of medications that work on receptors in the brain. Therefore, not only do they help to control pain, but they also may have significant side effects, including that mental fogginess and grogginess. Other medications come from a different class and have a different mechanism of action. So for example, the nonsteroidal anti-inflammatory medications work differently just on pain receptors. They will not have any mental side effects in most people in terms of grogginess. One side effect that they can have is gastric distress. So you always want to take this with food in the stomach. And the medications that I'm speaking about are Advil, Motrin, ibuprofen. Those are some of the over-the-counter suggestions. Some of the prescription varieties would include naproxen, Anaprox, Toradol. These are all widely used, and they're quite helpful for pain and inflammation, which is something that I find to be very helpful in my post-op patients. In addition, you have acetaminophen, also known as Tylenol, also works as a fever reducer and a pain medication. These are not narcotics, and other than taking toxic dosage, which could affect liver function, they're quite well tolerated, and we typically just try to limit dosages throughout a 24-hour period.
Okay, great. Yeah, thanks for explaining that. We definitely have, since this is a mom community, we have a lot of nursing and breastfeeding moms here. We have a few people asking, what do we do to manage pain when we're breastfeeding? Are the opioids safe during breastfeeding?
Look, again, everybody has an individual pain tolerance, and opioids are excellent painkillers, but they do come at a cost. So what I typically recommend during nursing for pain would be the over-the-counter or prescription nonsteroidal medications that I just mentioned, in addition to acetaminophen, which you can actually take in combination, and these things are deemed to be safe during nursing. In addition, I recommend comfort measures. If your C-section incision, for example, is bothersome, consider a heating pad or warm compress. If you are feeling warmth in an incision, you could try an ice pack. But most of the time, if you stay on a regular regimen of even these over-the-counter type non-narcotic medications and don't let breakthrough pain really come through, you'll be pretty well managed. Keep in mind that pain also gets better with each passing day after delivery or after surgery, so that the medications become less and less necessary as time goes along.
Okay, good information. Thank you. Are opioids prescribed right after surgery typically?
It's different for every practitioner and different for each patient. I would venture to guess that opioids are prescribed at some point for many people undergoing a surgical delivery, but post-operatively, we try to rely on non-opioid medications most. I've had excellent success with this long-acting injectable anesthetic, which is a local anesthetic, injected directly into a C-section incision or into a particular tissue called the peritoneum at the time of delivery. And this lessens the need, and in some cases completely eliminates the need for post-operative narcotics or opioids, and we can just rely on some of the non-steroidal medications. One of my favorites medications for post-op is called ketorolac or Toradol. Many of you may have heard of this. It can be used intramuscularly or intravenously right after delivery and is really helpful for pain and does not involve all the grogginess and addiction potential that opioids face.
Okay. And Dr. Dweck, do you think that doctors should stop prescribing opioids?
No, of course not. And I think there's a place and a time for opioids, but I think the country is facing a crisis right now with opioid dependence. And myself as a healthcare professional, I feel it's, in part my responsibility to do my part to educate people that there are alternatives to opioids and to try to prevent the little bit that I can with dependence, especially in light of the fact that some people become dependent with their gateway into opioid use being surgery. So, that's a very important job for me, and I would like to help people to prevent dependence in future.
Right. Okay, great. Another question, for someone who has done breast reconstruction surgery, is the long-acting injection possible for breast?
Yes, the long-acting injectable
Apologies
anesthetic.
for that strange noise. Sorry.
No worries. Is perfectly fine after delivery. So we don't typically recommend that injection while pregnant or for people under 18 years old. However, after delivery, it is absolutely acceptable and considered safe for breastfeeding.
Okay, wonderful. Okay. All right, thank you. Another question here is, someone asked, should I find alternatives when it comes to doctors prescribing my son pain meds after a surgery? My son is 13.
Well, I can't really comment on your son's specific issues, and this long-acting injectable anesthetic that I'm speaking of is not meant for people under 18 years old. But look, surgery is surgery, and it does cause pain. So something may very well need to be prescribed for any type of surgery, and I think we just have to make an active decision about the type of pain control we're looking for. So it's a conversation that you need to have with the healthcare provider for your son.
Okay. Another question here. You mentioned feeling pressure to prescribe more medication than necessary. This person is wondering, who is the pressure from? Is it from patients? Is it from surgeons?
Great question. This is pressure from all angles. So patients are fearful. I find that many times education will help to allay fear. People are afraid of pain, and that's understandable. That's where the realistic expectations of what somebody is going to experience after surgery is so important in terms of having that conversation. I think that most doctors should be aware of various alternatives in an effort to prescribe what's proper for you and your needs.
Okay. Okay, thanks. And then another question, we have a lot of great questions coming in from the audience here. One person's asking, I'm allergic to codeine, so the post-op med that I was given was ibuprofen. However, at the hospital, they tried to convince me that I needed something stronger. Is that normal for hospital staff to try and convince you to take opioids?
Well, look, hospital staff is trained to take care of their patients and make them comfortable. So I think that every situation is individual, but if you're having significant pain despite the non-opioid medications that are being prescribed for you, then an evaluation may be necessary to ensure that nothing else is going on. And then you may need to either add a secondary medication, which might be an opioid. Again, opioid use typically should start to diminish both in dosage, duration, and length of use as time goes along from the time of your surgery. So I think, again, that's probably an individual situation, but most hospital personnel want you to be comfortable.
Okay. All right, good to know.
And I will make one other just comment on that. There's nothing wrong with combining a couple of medications together. So sometimes in an effort to lower the amount of opioids that we're using, we will say use a nonsteroidal and acetaminophen. Sometimes we'll even add a steroid medication or an antihistamine or something else that might help with some of the symptoms that people are enduring and help calm down some of the pain as well.
Okay. All right. And Dr. Dweck, when do you think a woman should start discussions with her OB about pain management during childbirth? I think you talked earlier about making sure you have a birth plan and things like that, but what would be the, when would be the right time if she'd prefer to have a non-opioid option?
Yeah, so I think this discussion can really be had anytime, but the time that I normally bring it up is about 28 weeks of gestation. I find that this is when, most women are coming in with at least a skeleton birth plan, and it's a perfect opportunity to bring up pain management. Many of the patients in my community and my practice opt to have regional anesthesia during delivery, so we'll talk about spinal or epidural anesthesia, and then we also will talk about medication for afterwards, which will include a discussion about opioids, their goods, their bads, and their alternatives.
Okay, great. Do you feel that there are any natural remedies that could help alleviate pain in the same way?
Absolutely, and I think that that's a great question. So I think mindfulness training before childbirth is incredibly helpful. I find my patients who go through breathing classes, Lamaze, and that type of regimen tend to do very, very well with their pain management because they have a mindset from beforehand. This certainly can lessen the amount of pain medication that's needed after a delivery or after any kind of surgery. I find massage, particularly with a essential oil like lavender, might be helpful for pain as long as it's approved by your particular healthcare provider for your situation. Some women find that warm compresses, warm baths, warm showers, or ice packs, depending on the timing, might be helpful for, localized and focal pain, particularly in an incision. So those are some complementary thoughts.
Those are great options. Thank you. Great tips. Now, another question here is, are pain management teams always available?
Well, I think that's individualized based on the facility that you're in. So certainly in a major hospital setting, a pain management team will certainly be available. Usually after delivery, many women will be having access to an anesthesiologist, particularly if they're having a C-section, and certainly for lots of women having vaginal deliveries as well. So pain management teams come in all shapes and sizes. Some of it may be just your regular OBGYN who's managing your pain, and sometimes it can be an entire anesthesia team.
Okay, all right, good to know. And we'll just cover a few more questions here before we wrap up. When someone has an extreme chronic pain with several medical procedures, what are some ways and other medications someone can use to safely replace, or not use opioids?
Yeah, so this is kind of a complex question because chronic pain comes in so many shapes and sizes, and I'm not 100% sure what medical ailments or surgical ailments this individual must be speaking about. However, most of what I've mentioned would be fair game, starting from over-the-counter medications, nonsteroidals, starting from some of the complementary measures that we spoke about. Many times local injections can be helpful. Cortisone injections, which is a steroid that sometimes can lessen inflammation significantly and help with pain. But again, a lot of this answer would really depend on your individual pain etiology.
Okay. All right. Good to know. And do you feel that non-opioid options are becoming more accepted by doctors?
I absolutely think that it is a conversation that's been opened up, and there's definitely a heightened awareness to trying to limit the amount of narcotics and opioids that are used for patient safety and also for, the social good, if you will. So sure, I think that this is definitely something that's been transitioning for a little bit now.
Okay. And what do you feel is the best way to broach this subject with your doctor? Is there any specific medical history or background material that someone can share?
I think that a candid and direct conversation is usually best. I think that if a patient of mine does not bring this subject up, then I'll usually broach it directly. I think that it's really important to be truthful with your healthcare provider about things like what medicines or herbal or complementary supplements you might be taking, because it might have a bearing on treatment. In addition, it's really important to let your doctor know if you smoke, if you drink a lot of alcohol, if you're using or misusing other recreational drugs, just because it might influence what's used for pain control after surgery. So these things are all important, and most likely your healthcare provider would be taking a very thorough history about medical problems and surgeries from past as well.
Right. That makes sense. Okay. And can non-opioid options also be used for other surgical procedures?
Absolutely. So in gynecologic surgery, such as hysterectomies or laparoscopic surgery, I use non-opioid options preferably over narcotics. So I lean heavily on injectable long-acting local anesthetic for incisional discomfort, and especially in this time where we're trying to do so many procedures outpatient and get people home in a less than 24-hour time. This is a very important option to have because it can last up to 72 hours and keep people comfortable once they go home and even for their car ride home. I typically use this for hysterectomies as well, and sometimes it will be in combination with a low-dose narcotic if needed. I know that my colleagues in orthopedic surgery are using these types of medications as well. So it really runs the gamut of surgical procedures and postoperative care.
Okay, that makes sense. Is it okay, in your opinion, to infuse opioids if someone doesn't feel that they need it, but the doctor feels that it's needed?
Sure. I think that, look, again, this is a conversation and there are a lot of moving parts, and what you go into surgery expecting you may or may not need may not be etched in stone, and you have to be a little bit flexible, both on the healthcare provider side but also on the patient side. So I like to keep options open, but certainly if patients tell me that they don't want to even entertain an opioid, that's perfectly fine, and we work with alternatives, and there are plenty of them to make people comfortable.
Okay.
The point is to have a healthy patient and a healthy baby, if it happens to be a childbirth patient, and to get people as comfortable as we can and back up to their regular lives in a timely way.
Right. Yes, absolutely. That's a good point there too. So, Dr. Dweck, in your opinion, I know this is like a big topic, but why do you think that opioid use has become so widespread?
Look, I think there are probably lots of different answers to that question, but what I can say from my line of work is that the surgical path is certainly an opportunity to use opioids or avoid them. So I think as healthcare providers, we have to do our part to educate the public, educate our patients and their family members that there are alternatives, that narcotics can have side effects, that they can have long-lasting side effects. And I like to take the factual information that's been provided by the studies that we showed that, there are a fair number of people, women at the top of the list, who are prone to dependence if not careful. And therefore, we have to do our part to prevent that.
Right, right. I have one really good question that also just popped up. What should we do to safely dispose of opioids? One person saying she has a lot left over and that doesn't like them in the house. So are there any tips?
Right. That's actually a great question. So what you should not do is flush them down the toilet because then it gets into the water supply. So I would make the recommendation that if you're still under the care of your healthcare provider, to take them back in and they'll dispose of them in a safe container. Many pharmacies or hospitals might take them back in their pharmacies in order to dispose of them properly. So that's what I would recommend.
Okay, wonderful. Thank you for that. And just, one final question. Where can someone go for more information on this topic?
Oh, right. So as I mentioned during the talk, the website planagainstpain.com has wonderful information. And I think that's a wonderful, good website with lots of resources.
Okay, wonderful. So, I think it's time for us to wrap up here, but we really appreciate you, Dr. Dweck, for taking your time to share with, all of us this really important information. It's so important for moms, especially this mom community, to know about this. It's so informative. It just really opens your eyes to this big problem we're having, but also knowing kind of, that there are other options like this out there. It's so helpful. So thank you again.
Thank you for having me. It's been a pleasure.
All right. Thanks to everyone for tuning in today. And again, we will be posting this recorded webinar on momsmeet.com. So if you want to go back and see the information again, or have any friends or family members who you think this would be beneficial for, please be sure to share that with everyone else. So again, Dr. Dweck, it's been a pleasure having you as our guest here. And I hope everyone else, I hope you have a wonderful day. Thank you very much. Bye-bye.